Last month, I had an interesting patient, Mr. K, who came to me saying that he had got typhoid again. When asked, why does he say again, he replied, he gets typhoid at least once a year. Trust me, Mr. K is not the only one. We regularly get patients who have been getting treated for typhoid very frequently. Do you think this is possible? Or something just doesn't feel right about this? Hello everyone, this is Dr. Jyoti Putran, physician with over 15 years of experience in internal medicine, practicing at low-cost clinic, Banshankari, Bangalore. For more details on our low-cost clinic, kindly check the link in the video description. Let us bust a few myths about Widal test today, which is one important and recurrent reason behind such wrong diagnosis of recurrent typhoid fevers. The first big mistake. I asked Mr. K, how many days of fever did you have before this test? He said, 3 days. That immediately raised a red flag because the most important thing people should know is that a Widal test should not be done within the first 7 days of fever. Why? Because the body takes at least 7 days to produce antibodies that the Widal test detects. So if the test becomes positive before 7 days, it may actually be misleading. This is one of the most common mistakes that we see in clinical practice. Why a positive Widal test can mislead you? Now let's understand something very important here. People think positive test means confirmed disease. But medicine is not always that simple. The Widal test has poor sensitivity and specificity both. Let me explain in a very simple language. Sensitivity. The sensitivity of Widal test is only around 40 to 70%. This means if 100 people who truly have typhoid fever get a Widal test done, only 40 to 70 of them will test positive. The remaining 30 to 60% of patients may actually have typhoid but still test negative on a Widal test. Now comes the bigger issue. The specificity is also very poor, around 45 to 75%. Now what does this mean? Out of 100 people with a positive Widal test, 25 to 55% may not actually have typhoid at all. Think about this very carefully. A person may receive antibiotics, become anxious, and believe that they have typhoid even when they may actually have some completely different infection. So is Widal really useless? Not completely. This is where things become interesting. The most useful thing about the Widal test is actually its negative predictive value, which is at around 95%. In simple terms, if the Widal test is negative, there is a 95% chance that you do not have typhoid fever. So if you correctly understand here, the Widal test is often more useful to exclude typhoid rather than confirm it. What is a truly positive Widal test? Now many people ask, Doctor, then what is considered a true positive Widal test? Usually, titers of about 1 is to 160 or maybe even higher is considered significant. But this cutoff varies from place to place depending on how common typhoid fever is in that area. But even more important is this. One single Widal test is usually not enough. Ideally, 2 tests should be done about 1 week apart, and the second test should show a rising titer, usually a doubling. This is what makes the diagnosis more convincing. But now think about the practical problem. By the time all this happens, almost 2 weeks may pass from the start of fever, and that delays treatment. So if Widal is not the best test, what is it? The answer is blood culture. Especially when done during the spike of fever, in the first week of illness, before starting any antibiotics, blood culture is still considered the best and gold standard for diagnosing typhoid fever. Why does all this matter so much? Now, this is the part that concerns me deeply as a physician. In India, many patients with fever are treated for typhoid simply on the basis of a positive Widal test. And this has consequences because unnecessary antibiotic use contributes to wrong treatment, delayed diagnosis of the actual illness, side effects, and most importantly, antibiotic resistance. Today, we are increasingly seeing multi-drug resistant typhoid. Medicines that worked beautifully for decades are becoming less effective, and misuse, or truly speaking abuse, of antibiotics is one major reason. So the take-home message is very simple. A positive Widal test does not automatically mean that you have typhoid. Timing of the test matters greatly. One single Widal test should be interpreted cautiously as it is inadequate. Blood culture remains the gold standard for the diagnosis of typhoid fever. And most importantly, do not start treatment only because of one positive Widal report. Please consult a qualified physician if you receive a positive Widal report, and if needed, do not hesitate to seek a second opinion before starting antibiotics. Thank you for watching. Take care, stay informed, and stay healthy.